For the subtalar medial to lateral calcaneal glide, we're going to try to create a gapping roughly in the anterior facet first. We're going to stabilize the talus and the lower leg against the table and attempt to compress the syndesmosis in order to further lock the talus into the table along with a little dorsiflexion of the ankle to push the talus deeper into the mortise into a bit more stable position. And also, in this exact model, it doesn't reflect that a large component of the motion here is an actual glide, a translation along the subtalar joint plane, and not just a gapping. So take that into consideration as you apply this translatory and gapping force. Locking the talus there in the talocrural, adding a bit of dorsiflexion with the thigh, compressing the lower leg into the table. Here I'm on the posterior aspect of the calcaneus. I get a little bit of gapping in the posterior aspect of the subtalar and a little bit anterior. But as I wrap around a bit on the plantar surface, you'll see that I get a larger gapping with much less force required right there. So it's important to find the path of most movement and respect the joint plane. So experiment on the calcaneus for that unique individual, as they may have a different axis of inclination of that joint and that axis. Now on a live patient example, we're going to take up the slack with the thigh of the therapist to slight dorsiflexion. Resting the fibula on the table with the hand under the fibula. The thumb is grasping the talus just above the sustentaculum tali and firmly applying pressure into the talar head to prevent movement. You're allowing movement to occur in the cuboid. You see the forefoot adduction that's occurring. That's normal. There's some decent motion here, but I'm going to move around to the calcaneus. And there's a bit more motion here. Now notice a lot of this motion is skin slack. Take out the skin slack, and everything rests is the joint. Compressing the distal syndesmosis for a high ankle sprain may be very important. For lateral medial calcaneal glides, same rules apply as far as finding the joint plane. Here, most of the force will be directed towards the posterior facet, finding the path of least resistance or most movement. Again, with the leg roughly at the diagonal on the table, taking out a bit of slack in the talocrural joint through dorsiflexing through the therapist's thigh, and stabilizing the distal tib fib and syndesmosis with the forearm, applying pressure in the thumb and the talus to lock out talocrural motion. Apply a force to the calcaneus in the path of most movement, taking out the skin slack first and feeling the remaining motion to be in the joint. To do the subtalar manipulation into inversion and to distract that posterior facet, side lying with a manipulative leg superiorly. We're going to apply a force into the leg where the femur is compressing into the therapist. There will be some tibiofemoral distraction, of course. So distract and invert, respecting that joint plane. Making sure you feel the path of most movement. Make sure your force is on the calcaneus. Distract, invert in the joint plane. Now to get the manipulation, it's important to stabilize the talus very firmly. That way all the force is directed towards the talocrural joint. It's a very quick manipulation with your thumb reinforcing your thumb. Now moving to the other side of the foot. Eversion, distraction, or really pronation distraction. Distract the femur pressing into the therapist. Ensure that you're in the joint plane by experimenting to find the path of most motion, allowing the forefoot to move freely. Distract and evert, pronate. To move to the manipulation, firmly apply pressure onto the talus in order to direct force inferiorly to the subtalar joint.